Good evening. So we are excited to host, I think this is part 4 of our COVID 19 Uncovered. And so we have some special guests that will be joining us soon in the studio from the Kent County Health Department this evening. So if you will hold tight, and then we will get the show started officially shortly. Good evening, everyone. Can you hear me? I think you guys, all of you are on mute. You are on mute.
Good evening.
Hello.
Hi.
Hello. See you all, my friends.
How are you?
I am good. I'm good. You know, it's a busy time, right? And not only busy, but very 2021 has started off to be very interesting. We'll just say that. So I want to thank all of you for joining us tonight, and I believe this is part 4 of our COVID 19 Uncovered series, where we started to with the intent and express purpose of just educating community, and especially when we realized that the numbers were going up, you know, and at the end of the fall, I guess, and into winter. We wanted to make sure that we were not only putting information out to remind people, because as a mentor of mine would tell me, repetition is the mother of all skill, right? So not only to remind people to stay vigilant, but also there was a lot of talk around vaccines and the execution of the vaccines. And so we wanted to make sure that we provided people with information from credible, reliable, science-based individuals and organizations to make sure our community can make the best informed decision possible. So again, I want to thank you all for coming on this evening and joining us. But before we get started, I'm wearing red today. I decided to put on my red sweater in agreement with the American Heart Association and their campaign, their Go Red campaign for the month of February, not only here locally and across the state, but across the country, to remind people that 1 in 3 women actually die of heart disease. And so, as I say all the time, although we are in the midst of this pandemic, we cannot forget all of the other health issues and healthcare outcomes that we have been dealing with for, quite honestly, decades. And so we still have to lift those up as well in our vigilance and make sure that we're just taking care of each other and in providing information on a variety of different healthcare conditions and outcomes. So shout out to my peeps at the American Heart Association. I attended virtually, of course, their Go Red luncheon here today in Grand Rapids. And so I want to thank them for the mighty work that they are engaged in. So what I want to do first is I'm actually going to, instead of reading your bios, I'm just going to have you all go through who you are and give us a little bit of background, and then we'll flow from there. I think many of us in community are very familiar with Teresa Branson in the great work that she does. And they have been keeping you very active and busy. So I want to give you all an opportunity to kind of introduce yourself. So Teresa, you want to introduce yourself and tell us a little bit about you and your role at the health department.
All right, thank you, Clay. And I just want to thank you and the NAACP of Greater Grand Rapids for organizing this series. I really feel it's an honor and privilege to be joining you this evening and with my colleagues here. So my name is Teresa Branson, and I'm the Deputy Administrative Health Officer here at the Kent County Health Department. I've been working at the health department for about 23 years, and I absolutely love public health. I absolutely love serving our community. And my role at the health department is overseeing the daily operations here at our clinic at 700 Fuller. We also have 3 other clinic locations across Kent County. and just overseeing those daily operations from environmental health to community clinical services to community wellness, administration, and we have a Center for Community Health Strategy. Throughout this COVID response, I've served as Deputy Incident Commander, working side by side with Dr. Adam London, who I'm sure many of you have seen and have heard from. But I work side by side with him throughout this COVID pandemic, and our medical director and the rest of our senior leaders here at the health department. So again, look forward to joining you for this conversation this evening. Thank you.
Thank you, Teresa. And ladies first, Dr. Gwen.
Thank you. Thanks so much for having me. My name is Dr. Gwen Unziker. I'm a family doctor. I've been practicing here in West Michigan for about 12 or 13 years. Moved here from Southern Illinois to do my residency and just never left. And I have been basically doing care for those that might otherwise be somewhat on the margins of primary care for a lot of my career, and I love it. My passion is education and helping people understand their health so that I can empower them to take control of their health. And my role at the health department is relatively new. I have basically been brought on just as kind of a consultant, which is just fancy talk for answering emails and calls and questions. I'm one of the faces behind the email address. If you email the health department with questions about COVID, I'm probably the one that's going to respond to you. And I've just been helping out with other communication and education projects wherever I can.
Thank you. Mr. Fortman.
All right, good evening. And again, thank you very much for the opportunity to participate. My name is Mike Fortman. I work with the Kent County Administrator's Office. I have been with Kent County for approximately 24 years, the last 2 in the Administrator's Office, but most of the last year, of course, has been very much involved with the Health Department and the COVID pandemic. I went to the Health Department on March 14th with the Costco humanitarian food run to supply staff there, and basically have virtually never left.
Right.
By April 6th, we had our first dashboard up, and I can't even count how many calls Teresa and I have been on together, sharing data with community and with internal and external partners at the county. My background is in mathematics. I'm currently studying for my master's in analytics, and I have no public health background, but like many people on this call, it's amazing how much we all know now about epidemic curves and mitigation strategies and things that we never would have thought we'd be talking about 2 years ago. So again, I obviously defer to Teresa and Dr. Zucker for medical things, but I have the charts, so I can show the data.
Well, Mike, I tell you, I think we've all had to pivot and become experts in our own lay scientists, right? in the midst of all of the madness. So Teresa, I'll go directly to you. So, people hear about the health department, we're familiar with it, and I think many of us actually know where the health department is located. But what purpose does the county health department serve overall for the community of Grand Rapids?
Yes, thank you, Clee. The purpose of the health department in any community, but the Kent County Health Department, our mission is to serve, protect, and promote a healthy community for all. And I always like to say, this is not our department, this is our community's department. Mm-hmm. As you mentioned, many people do know where the health department is. We're kind of that, safety net in the community where people oftentimes go first time for help, or if they just don't know where to go. So we're here to support. Oftentimes people think about public health as behind the scenes. There are things that you don't really have to think about because we're busy taking care of those things. So, right. When you go out to dine at restaurants, we're doing the restaurant inspections. When you turn that water on, we are providing home visits to moms and families, and we're caring for some of the most vulnerable infants in our communities. We are doing lead inspections in some of the homes across our communities. We are providing WIC. We are providing immunizations. We are providing personal health services. We're doing education. We screen 90,000 kids every year in hearing and vision. We're out educating students on life skills. Multiple things we do in public health. Many people don't know that the animal shelter is a part of the Kent County Health Department as well. So anything you can think about in terms of community clinical services, our environment, and we've certainly have seen a lot of emerging, really wicked public health issues well prior to this pandemic that we've had to tackle in our community, whether that's been PFAS or vapor intrusion or lead and the impact that those issues have in our community. So, Clea, I greatly appreciate at the start that we have to be mindful of all of the different types of health issues that our community is facing. And also the things we faced during this pandemic that we saw in our community that are also public health issues. So that is who we are. We're here to serve, protect, and promote a healthy community for all. And no time have we seen that than what we've experienced with this pandemic. This is the pandemic of most of our careers. You know, we've never thought we would see something quite like this. There's different types of coronaviruses, but when March 12th, I think around that time we had our first case, all hands on deck to try to figure out fast and furious what this is, how it's impacting our community, and just to get out in front of it.
Yeah, you know, that's interesting because a lot of us, you know, we've been, I think probably all of us, quite honestly, we've been on some level traumatized, right?
Right.
And so I actually went over to visit the animal shelter because I was thinking about getting a dog again.
Okay. Good choice. Good choice.
So I'm like, you know, I had my lab, Cyber, for about 17 years. She was a black lab.
Okay.
And haven't had her in probably about 3 years or so, 4 years, I think. And so I was thinking, you know what, I need to get me a walking buddy, and get out to take in some of this fresh air. I want to say, I'm sure all of you probably have seen, I want to say it was after 5 or so today, there was breaking news about President Biden, and he announced that they have secured another 200 million doses of vaccine, in that now they're hopeful that, and this is just what the report said, that every American will be vaccinated who wants to be vaccinated by July. And so I thought that was interesting news. And so that leads me into the next question, because we've heard, you know, people have talked about the hesitancy that allegedly exists in Black and Brown communities, but also to lift up alongside of that is what seems to be shaping up as a disparity in terms of getting the actual vaccines to specifically not only the Black community, but other communities of color, especially when you look at the percentages. And I'll just take New York City as one, where you look at the glaring disparity in terms of who's actually getting the vaccine in New York and who's actually not getting. When you look at, in just raw numbers, when you look at the Black community versus the white community. And so there is a significant disparity that exists. So with that said, how is the county tracking the demographic breakdown of what communities are actually getting the vaccine? Or are you guys tracking that type of data?
I'll turn that to Mike right now to go on through the data piece of that. And I would like to come back to speak to the breaking news and the role the health department has with in the states taken with vaccine distribution.
Okay.
A quick question: would this be a good time to show some of the data we do have?
Yes.
Let me do that. The vaccine data is very, very new and fresh, but and we're still working hard to get more. But I'm going to go ahead and share our COVID dashboard that we do have right now. Just one moment.
And
Yes.
Mike, as you're pulling that up, as we're getting the presentation on the screen, any one of you can feel free to immediately jump in and answer the questions and or share some additional information with respect to the questions that we put out there and just the conversation in general. We want everyone to feel the love tonight.
Right. And Clee, while Mike is getting ready to share that data, I just really wanted to say I really appreciate that question. We have worked very hard to address the disparity there. I mean, even well before the COVID vaccine was available and well before we even had our first case here in Kent County, we were watching very closely what was going on in other states, what was going on the southeast side of the state of Michigan with the gross inequities there amongst Black and Brown communities that were being highly impacted by COVID. And I always was saying at that time, it wasn't a matter of if, it was a matter of when we were going to start to see that here. And then we started to form a race equity and inclusion team. So that's another role I have within our COVID response, is leading our race equity and inclusion efforts. And just, again, starting to have those conversations very early on during this pandemic with multiple racial, ethnic population groups and leaders. And really just to kind of get a good understanding of vaccine hesitancy, of what people's questions and concerns were around COVID in general, to understand what people's needs were. Now with vaccine on the horizon, we know too that there's going to be disparities. And so I'll turn it over to Mike now so he can kind of give that overview of some of the data, where we were, how things are looking now, and how we're beginning to try to track that data around vaccines and some of the challenges there.
All right. Thank you, Teresa. So up on the screen is our public dashboard, and there is a whole lot of data out here, and I'm definitely not going to have time to try to cover each piece, but I just kind of wanted to show it in general, just so you understand the type of information that we're collecting and the type of information that the people like Teresa and Dr. London and Dr. Bohr at our health department are using for making their decisions. So we publish this every day. It includes up at the top, you can see a daily case count, our total number of deaths, new cases and new deaths. And it also has some graphs showing the epidemic curves for local counties, and also a comparison of how that looks against the state of Michigan. Probably a much more relevant page to most people and to this conversation is, how many active cases do we have? How many people have recovered? And of course, how many deaths? We break this down. We have this information, case counts available by zip code. We have a daily running chart down here at the bottom of our cases. This dark blue line is our 7-day average, where we peaked at 689 cases a day back on November 19th for our 7-day average. We are now actually just slightly under 80. I think 79 is the last number I saw, maybe possibly 78. Deaths, as we've all heard, tend to lag the cases, and that has certainly been the case here. Our peak deaths number of cases occurred back in mid to late November, but the deaths unfortunately continued to occur even after that peak. And even as the cases continue to come down, we're still seeing some deaths from this large number of people who got infected in late November, early December. That's improving, but that's still something that's occurring. Again, very quickly, we do analysis where you can compare your county to the entire state to see where there's the state's curve. We also look at testing, and this is really key. Again, I'm not going to go into all the details of each, where we peaked and all these things, but just to point out that the statewide average for positivity is currently 3.9%. Kent County, we're a little bit behind that. We are currently at 4.1, but our peak 7-day average was 16.8, again, back in November. So significantly improved to go from 16%, almost 17, down to 4% positivity rate. And again, we can compare this to other counties, and we do possibly if we start discussing the UK variant. We're able to use our dashboard to see other counties and see if we can see any indication of them increasing to give us a heads up, which ties right into what Teresa had said earlier. When this whole thing started, we were looking down in Southeast Michigan to see their pandemic because they were a few weeks ahead of us. And I think back as early as mid-April, before we had any evidence of disparate impact in Kent County, Teresa was already emailing me to do an analysis on our testing positivity rate because we could see it happening in Southeast Michigan. We knew that was coming our way. Again, so quickly onto the vaccine data. At the moment, I do not have vaccine data. Sorry, go ahead.
So,
yes.
so Mike, I'm going to probably interrupt you as you're going through some of the data because I want to make sure I don't miss any of the questions that might arise as a result of the data. So when you talk about the positivity rate and where we are right now compared to where we were in, say, December or November, are you concerned with the reopening, and not fully as we understand, or I should say, is the health department team concerned with the potential increase in that positivity rate based on restaurants and bars being open at a limited capacity? Because I got to be quite honest, and when I live in an area that's in the city, and it is very walkable. There are a number of restaurants and a number of bars and other places. And so when the day that, those establishments were open, I was actually going home and noticed that one particular establishment was pretty crowded. And also, and because there's full glass, so you can clearly see into this establishment, but there were not many people in that establishment wearing masks. And then on the outside, there were people taking, I guess, what you call a smoke break, and they were in very close proximity, and none of them had on any mask either. So. And excuse I think we got an alarm that was triggered real live. So are you concerned about that? And I'll put myself on mute.
I'm going to start with that, but Teresa is really the best person to answer this question because, again, I'm the math person, not the public health person. What I will say is if we see anything happening, I'll see it in the data and it will go to Teresa. Now, whether we should be concerned ahead of time, again, I defer to Teresa on what she thinks the impacts might be. I'm just confident that we will see them quickly.
Thank you, Mike, and thanks for that question, Clay. As you started out earlier today on this call talking about 2020 and 2021, yeah, it certainly has been a tough tough year and tough year ahead that we're facing. But with more things becoming open, I have hope and concern. So do I think that we're going to see the positivity rate go up because more things are opening? It could. Am I concerned for that? I am a little less concerned with that because we have vaccine. I'm also a little bit less concerned with that because I know we have a lot of great people in our community that have been helping us contribute to these numbers going down. We were at a point sometimes where we were seeing the cases at 700, 800, 1,000, new cases, and to have that number go down to 200, 100 tells me that our community is doing their part. So that gives me hope that people are taking every preventative measure that they can, that our businesses of all sizes are taking every step and measure that they can, because COVID has really hit our business community very hard as well, and particularly smaller businesses. So do I have concern when we're opening up and it's not at full capacity? I think that's been the way to go, to have different businesses slowly open up. I think that's just another safeguard that we're able to put in place. There's always going to be individuals and people that don't want to comply And the state has also made a lot of improvements and provided a lot of resources for people to be able to call in and report anonymously as well for different businesses that may not be in compliance. We also have an employer-employee support team as a part of our COVID response. So oftentimes I'll receive different questions too from businesses on, hey, I'm getting ready to open. Can you take a look at our plans? And so we've been very, very happy to look at different business plans just to say, hey, here's some other things you need to consider based on the guidance. If we say something, we're going to say something. And that's what we're asking our community to. We can't be everywhere all the time, but I can certainly say I've had a lot of community leaders contact me, contact other people in the department. Just if they hear something, they're picking up the phone, they're calling, and we're working with the state, my OSHA or environmental health unit and enforcement so that we can get out there, investigate, and see what's going on. Because again, our goal is to serve and protect community health.
So Teresa, just real quick, because it you know, when you talk about you're less concerned because of the vaccines out here, right? I just want to make sure that folks understand one, that they still really need to be diligent in terms of washing hands, wearing masks, social distances. But I also want to make sure that folks understand that the vaccine is not a cure. And it is a preventative measure in case, you know, you get sick. It's my understanding in my research and study is that if you end up testing positive, even after the vaccine, it will prevent death and lessen the symptoms and the downtime and all of those things. But in addition to that, there is conversation out there with respect to, you know, the vaccines having a potential of actually protecting you from getting the vaccine. But I don't want people to leave this conversation and the many other conversations that we will have with thinking, okay, now since we have these vaccines, we can go out and do whatever we want, still not protect ourselves, still not wash our hands, still not, you know, social distance, still just not, at the end of the day, be respectful of each other. Because quite honestly, I said this from the very beginning of the vaccine or from the pandemic, the virus, is the things that they were saying that the science was saying we should do, we should have been doing those anyway.
Right. Yeah.
You know, and I'm not, you know, barring wearing masks, but, you know, washing your hands when you go to the restroom, washing your hands when you come into the house and before you go into the refrigerator and, you know, and just being careful of, you know, the tone of your voice and in the secretions that actually come as a result of screaming and yelling and all of those sorts of things. I just wanted to put that out there.
Yeah, and thank you. Thanks for keeping me grounded, Clay. For me to say that I have, you know, some less concerns, and it's all because we've been seeing these cases go down. I'm very thrilled that those cases are going down. I'm not thrilled about the number of lives lost in our community. That's kind of like at the root of this. And you know, COVID-19, you know, it's nothing to take lightly. It's no joke. It is you know, some people are saying, is this a thing? It really is a thing. If you ask anybody that has been, when COVID has hit home, I've had plenty of this hit home in my own family. So it is something to be very concerned about even after vaccine, because you still have to wear a mask. You still have to take every one of the preventive measures. You have to, you really have to just be very mindful because what we know is, I mean, we have different strains of COVID now. COVID from the start, you know, we were learning different things and then we'd learn new things. We said, well, here's the symptoms. And it's like, wait a minute, here's all these other symptoms. So this virus has not behaved the same throughout. It has changed. The symptoms have changed. what we've learned. At one time we were saying, okay, what's not in the air? It's just, through the respiratory, droplets. And so much has changed, and things could change again. And it's in the vaccine, was released under the Emergency Utilization Act. So because of the threat that this was having to our society and to our communities. So there's much that's still being studied around that vaccine, but it was released as being safe and effective. And when we've been over a year, and the only weapons we had to fight this pandemic has been communication, education, information.
That's right.
Testing, so people know their status. And then we moved very quickly in our community to make sure that our Black and Brown communities could get tested, even if they had no symptoms, because that's how significant this was in our community. We said, you know what, if you're in these zip codes and you want to get tested, we're going to test you. So we're still going to have to do testing because not everybody's going to get the vaccine. With the announcement that was made today that everybody that wants it, people have to be able to make that decision for themselves. That's what I tell everybody that I love and care about, anybody that calls and asks, is, we want the Kent County Health Department wants people to make, their own choice. We want to provide people with the facts. So if we provide people with the facts, educate, make sure we're being very transparent about things, being timely with our communications, then people can make the informed choice for themselves, for their family members, and for their colleagues, and for their community. But absolutely, Clee, this is something to be very, concerned about. And I really do want to, again, thank all of our businesses and community that have made a lot of difficult choices to help slow the spread. Many of our businesses, like many of our church pastors, deciding to close the doors, even though they were exempt from a lot of those things, but they decided for the out of the best interests of the communities and the congregations they serve, that it would be best to close the door. And I know that had a significant impact on many of those institutions in our communities.
Right. Yeah. So, Mike, I'm sorry. I know that was a long interruption, right? So you want to continue with more data?
Yeah, if somebody wants to pop the screen really quick, and I will get through the last couple screens quickly. There we go. So I did see a question in the chat about Wood TV reporting 2.85% positivity. I have not updated our dashboard today. I don't do it until the evening time because I get data from 4 different sources. So they don't all get settled until the evening time. Also, I tend to report on averages, like the 7-day average, because on any given day, the number of tests performed and the time it takes to turn them around and can kind of cause a lot of variation on daily numbers. So I'm not sure that when I get the data that I'll disagree with Wood TV 8. We'll just, like I said, I tend to report things on the 7-day averages. So that again, without seeing that report, I can't be definitive, but that's one potential difference there. So we discussed the testing really quickly. I just want to show that we do have a vaccine dashboard. And again, we can look at Kent County, and I'm really happy to see that through, I think this is Wednesday, we had 108,000 injections in Kent County, vaccinations. 75,000 people have gotten their first dose, and over 30,000 have gotten their second dose. Our target, if we want to hit, what we might consider herd immunity of 70%, is 351,000. We have a long way to go. But I'm just really happy to see that we actually have some color on this chart. We're actually starting to make a move. One thing that you also noticed, though, is that this line that had been increasing is somewhat flattening out, and that gets back to your earlier conversation or comment about we just aren't getting the vaccine fast enough yet. And you can also see by this dark blue line, which represents second doses, that if we don't get more vaccine, some of our vaccine has to kind of go into second doses just to be timely based on the Pfizer and Moderna recommendations. So again, I'm really hopeful that as we start to see more vaccine come in, that we'll see this line start to go back up again.
So
right
Mike,
in the center here, it says that we do not have demographic data. Yes.
I was going to ask you how many, can you repeat that, the number of vaccinations that have been provided so far in Kent County?
Yeah, it's 108,000. And let me check again. This one is this is through Tuesday. The data was updated yesterday, but the state, there's quite a reporting lag because they get this from pharmacies, hospitals. So it's always a couple days behind. But again, we've done 108,000 in Kent County.
Okay, and is that broken out by zip code? And I ask this question again because we hear about the hesitancy, especially when it comes to the Black community and brown communities. So is that are those numbers broken out, and can you speak to that by zip code, specifically the 49507 zip code and then the 49506?
It is not yet, but it should be on our dashboard early next week. We're actually just this week started receiving information from our hospital systems, and we're working on getting more detailed data from our pharmacies. The state of Michigan is not providing that to us yet. So in the meantime, we've done everything we can to try to get the information here. And again, just between the health department and the hospital system, that is the majority of the vaccine right now. So if we can just get our hospital data into the dashboard, we will have it by zip code and by race and ethnicity and by age. All of that would be broken down here, hopefully within days, certainly by next week.
Okay, I was just going to ask, there was a question from a viewer that asked, is it actually reported by race as well? And you just addressed that, so thank you. It
absolutely will be. We know that's very, very important. And to show that, why we know that's important, this screen here, a ton of information. The only thing I really want to point out is the size of these lines. These are the months, and you can see just how huge our cases surged in November, and then as we started to come back down into February. But really importantly are these columns over here on the left that show the percentages of infection by month in our Asian, African American, Caucasian, and other race categories, which includes the Hispanic population. And we expect to see Asian community at 3%, African American and Hispanic closer to 10%. But you can see early in the pandemic, Asian community was 3 times their expected rate. African American was over double their expected rate, and Hispanic was well over 3 times their expected rate as well. So again, I don't want to go through all the trends, but just simply to say that we have this data. We are tracking this data. Teresa's the head of our race equity inclusion section. We review this data every Wednesday as a part of that group. And we will be getting vaccination demographic data. But even in the meantime, we can see the impacts of what's happening in these different demographics and break it down by zip code and by deaths and by age groups. Again, I won't go into all that detail, but we analyze this madly every week.
Mike, can you speak to the unknown?
More quick click and then I'll pull the next part. Yes. Yes.
Can you speak to the
so we do have
what is unknown race and other race?
Yeah, so the demographic data is not collected when people are tested. This is actually what we get from the patients when our health department makes the phone calls, the contact tracing and investigations you've heard about. And we are not always successful reaching people. We don't always have good numbers. Some people don't want to talk to us. That's pretty, for various reasons, whether it's trust with the government, or documentation status. There are reasons that people don't want to speak to us. So if we can't make that contact, or if the people don't want to share that information, it will be unknown. And I will point out that we had a very large percentage of unknown in November. And that is just simply because the case surge was so huge that our contact tracers couldn't keep up. So we had to prioritize age 65 and over, I believe, and 21 and younger, and teachers, because we were, of course, very concerned about schools. So that's always an issue with any data, but it's certainly a concern here. What I will say is that even with the unknowns, we can still look at trends over time in each category, and we do that. So I can tell you right now that we're seeing a slight uptick in the African American community for the month of February, don't have an explanation for that, but it's concerning, and we are trying to address it with the health department.
So, Mike, with respect to that, I was going to ask, are you seeing any trends and outliers specifically in the 49507 zip code and 49506 zip code? And what I mean by, is there, I'm pretty sure when individuals go in and they test positive, just like with a variety of other things, there are just certain demographic qualifiers or whatever that's asked, like your age, your sex, are you seeing any, again, based on some of those things, any outliers or trends when you say, specifically in the Black community, you see an uptick, a slight uptick?
Yep. So what I can add to that is that, again, it's been well reported all over the country about the disparate impact of COVID in communities of color, whether it has to do with the type of work roles they might be in, intergenerational housing, and all these other factors. What I can see in the data, again, not the health expert, but just in the numbers, is that the communities of color, when the caseload starts to drop, they seem to drop a little bit later. Just typically within weeks, but that is part of the reason I think we're seeing that 12.8% number for this month, is that as the caseload continues to drop, the community colors tend to catch up a week or two later. So I'm optimistic that we're going to see that level out. But again, when we start to get demographic data on vaccines, I also we will want to look and see if this could be also a result of who's getting vaccinated and who hasn't gotten either an opportunity or has been hesitant to get vaccinated. So that also could be a factor in why we might see changes in the percentages.
But again, I just want to be clear, based on the research and the science, is again, the vaccine is not a cure. Right. So I just want to I don't want to give any, put any false pretenses out here as well with respect to that. So.
This is the last screen because I definitely want to make sure that everybody has more time to share information. We also, just to say the same thing we talked about with race, we're very focused on age because of the impacts that COVID has on different age groups, particularly, over 70% of our deaths are in people age 70 and over. So we're always worried of that, and also looking at the school age population as we continue to see schools open up, particularly at Grand Rapids Public Schools, that has gone back into more of a in-person modality. So again, that's a lot of information. So I'm happy to take questions, but I'd like to go ahead and bring this down so we can continue on the vaccine.
Thank you, Mike.
Yes.
So Dr. Unzinger, you mentioned earlier that you are, fielding a lot of calls for the King County Health Department. What kind of or what type of calls are you getting? Are there calls about vaccines, or what kind of calls are you getting?
So it's been interesting to see how the frequently asked questions have changed over the course of the last few months. Back in November, when we had that huge spike of cases, it was all about contact tracing and quarantine and isolation. And now most of the questions that I get every day, I kind of joked a couple weeks ago, it was easier for me to make a folder of questions that were not vaccine related in my email because there were so few of those compared to everything being about the vaccine. A lot of the questions that we're getting from the website are logistics. When can I get my vaccine? Why did my younger neighbor get her vaccine before me? Those types of things. And some of those questions are a little bit tricky to answer because, there are so many moving parts. My role as a family doctor is to kind of help break down some of the medical questions and some of the science behind it. But even that, I think, just if I don't know the answer to something, knowing where to direct somebody to get that answer is helpful too. And that's why it's great to have the whole health department working together to just be able to put those moving pieces together into something that actually makes sense.
Okay. I want to just go to a couple of the questions in the chats field here, and I think this is more of a comment than a question. Jerome or Ben Jerome talks about this is why racism is a public health crisis. And he also asked this question: is there any commitments to address systemic racism in the county health system? And then Daryl Fisher, she kind of breaks the numbers down based on the data that Mike listed. 108 vaccinations, and date includes the first 75K and second dose at 33K. If the goal is 502K, are we just at 6% of the goal, right? Which is whatever she puts 33/502. So anyone want to respond to the comments or the actual questions?
Yes, I'm looking down at the screen here at the comments there again. Let's see where to start. Yes, I want to start before the one with racism as a public health crisis. There's a comment regarding contact tracing. Kent County, when it came to contact tracing, I think we were one of the counties that probably was very more aggressive with our contact tracing approach in terms of hiring people to, we were using probably about 70 to 90 of our own staff at one point to help contact trace. We partnered with the Black Impact Collaborative and another agency because we were very concerned about not having contact tracers to reflect the populations impacted by COVID. And so when Mike mentioned kind of the not being able to keep up wasn't, about the skill and the level and the quality of the contact tracers we have, because they have done a phenomenal job as public health partners in helping us in that fight. It's just when your cases are tripling daily, nobody in Michigan could really keep up with that. So were we able to understand really what the degree of COVID was during that time? That made it very challenging to do. And no doubt people, were probably not being contacted in as a timely manner, but we worked very hard to kind of get that back on track. But all throughout, Kent County was still most of the time outperforming the state as a whole. In terms of, racism as a public health crisis, I can tell you that, the fact that we, like I said, I like to kind of say, I love to be as transparent as I can. And so, hearing the question about that we don't have that data on race ethnicity yet, but that it is coming as soon as next week. An announcement made, I believe today as well, from the state of Michigan for getting us that data for our counties by race ethnicity. We don't have a timeline of when we're going to get that from the state, and that happens sometimes, so for whatever reason. I think even with the testing, because some of the numbers were so small in our Black and brown communities, we really couldn't share that data without in a way that would still protect the individual's health information. So that has to always be our number one priority, is making sure we're following those laws and rules and regulations around HIPAA and protecting health information. But as soon as we could get it to a threshold, then we did release that data to our community. So we've seen multiple people discuss racism as a public health crisis, and that is something that the Kent County Health Department, we do not shy away from that. Race in COVID, if anything, just some people have said, it's just kind of shed a light on that, when in fact that light has been glaring throughout history for a long time. And so, but I think for some people in our community, when things were happening and the intertwinings between injustices in our community, that were going on, kind of these dual pandemics of the intertwinings between racial injustice and racial disparities in COVID going on at the same time in our communities across the country, being outraged by both. How could a pandemic be hitting our Black and brown communities so hard, and at the same time life being literally squeezed out of people in our amongst our brothers and sisters, and unnecessary police brutality. So you really can't separate some of those issues. So when I hear like racism as a public health crisis, racism is a crisis. Racism is a crisis across our community. When I look at the local public health system, that is more than the Kent County Health Department. That is our county government. That is our schools. That is our hospitals. That is our courts. That is our correctional facilities. It's our schools. It's everything that makes up these systems. You know, if you really look at some of the root causes of health inequities, it's more than about the individual, you know, choices people make. The systems that are designed to be there to support and designed to be there to provide access to people who need it most are oftentimes the systems that may have policies and practices that may be designed to create barriers. And so that's one of the things with the race, equity, and inclusion work through this pandemic and before that I've not just myself, but our many of my colleagues here in public health, many of our community partners that represent the Black and brown communities have worked very hard to try to identify what those barriers are. I've received calls late at night, and I will always answer the call. When are we going to get testing in this community? And so it's like, all right, well, let's talk about how we can get that done, and how we can partner together to do that. So yeah, racism is a crisis in our community. It's going to take a lot of people, one, recognizing that and understanding how these systems work together. But I think one of the biggest steps that we're trying to take right now is to make sure that our community isn't engaged at the last moment. So as we're beginning to prepare for community vaccination sites, we're extending like invites to engage community at the table, not just to send something out later to say, what do you think about this? No, we need to know what people think now. We've held stakeholder interviews to hear from people. And then actually taking action. So people, I mean, I could have my plans, and I've had plans, and I've had Clea and other ones share with me. That's not going to work. We don't need any more of that. Okay, so what do we need? And then just being willing to take that step back, to listen to what community needs and be ready to deliver. So
I agree, Teresa. I do. However, I do think that I've worked in the healthcare industry for my entire career. And so worked for the largest healthcare organization in the country, worked there for 25 years. And then I've worked also at a national dental managed care company prior out east, and as well as for the Department of Health and Human Services in DC. And so, I say this, sometimes we got to call it what it is. Racism is a public health crisis. I think about the fact that we were totally devastated in December when one of our youth council teens, Honesty Hodges, lost her life to this horrific virus. And we have to think about what happened along Honesty's short life journey here, when she was accosted by dozens of white police officers, male and female. And so we know what the data says that stress can do on our overall health and body.
Absolutely.
Not only physical, but emotional and mental. So that's real. And so sometimes we just got to call it what it is. And in order to I always say, you cannot start the healing process unless you admit that you actually have a problem, right?
Right.
That
Right.
there's a problem, right? And
Mm-hmm.
so we just need to, we really need to call it what it is. And I will say, so again, I appreciate your transparency and Mike's transparency and Dr. Unziger's transparency tonight. And that really what this is about. It's not
Mm-hmm.
just about for us as the NAACP, because one of the models in the NAACP, not just locally but nationally, is that we are done dying. We are done dying, right?
Yes. Yep.
And so that's why we decided and made a conscious effort in partnership with Kent County to say we need to bring this information, right? And make sure we are educating our community, right? And when I say our community, Black community specifically, and brown communities, because we know that oftentimes information doesn't get distilled down until the 23rd hour. And then it may be a little too late to receive that information. So one of the things, Dr. Unziger, and when I think about the cause that you're receiving, and I know Teresa has sent out information on the actual vaccination clinic at the Voss place. Are you getting a lot of calls with respect to appointments there? And do you want to share a little bit about the hours of operation and how people actually can schedule an appointment?
And I may have to actually defer back to Teresa on some of that.
Okay.
But a great resource to find out more about that would actually be the vaccinatewestmi.com. There's a lot of information on there that actually has not just information about the DeVos Place vaccine clinic, but all around West Michigan, things that are available. And there's a way that you can basically register, put your information in, and then you are on the list to be called when your turn comes up. That may not be as soon as people want it to be, unfortunately, because again, it has a lot to do with how much vaccine is available, as well as the resources to actually administer that vaccine. So it's dependent on not just do we actually have the vials of vaccine, but do we have the staff and everything ready? So are the appointments available, that sort of thing. So one of the questions I get a lot is, okay, I'm supposed to get my second dose in 3 weeks, but they didn't schedule me until 4 weeks after my first dose. Is that okay? The answer is yes, it is okay. But again, it just has to do a little bit with appointment availability and things like that. So in terms of the specifics of the vaccine location, I may have to kick that back to Teresa because I think she's a lot more involved in that than I am.
So the specific question you want to know about the West Michigan Vaccine Clinic at DeVos Place?
Correct.
Okay. Just the location in general. So this is a partnership between Spectrum Health, Mercy Health, and the Kent County Health Department. We also have the West Michigan Vaccine Collaborative that is also a partner to bring about that clinic location. We know that location is going to serve a lot of people, that has the capacity to do, I believe, 20,000 people per day. So when we look at different locations and different facilities, and that we know that is a location that we'll be able to do mass vaccination with the amount of space that's needed and the specs that are needed, and having separate places for vaccine storage, waiting areas. The facility has a multi-language support area. One of the things we were really encouraging, just another role I have with our communications team for that initiative in community relations is about 500, we're trying to build this list, but about 500 community leaders representing different organizations and institutions. We invite those leaders and community to tour the West Michigan Vaccine Clinic at DeVos Place. What we have found when many of our communities have done that, particularly some of the Black and Brown community leaders, they can experience that facility and space for themselves. And what we're hearing very positive feedback that they then can take back and champion. It's better for them to get a feel for the site and location so that they can share what their experience is. However, we know that that site is not a one size fits all. We know that we have to plan for vaccination far and wide in our community, and we're doing that. So in addition to that location, actually right now outside these doors here, we're running our Thursday evening vaccination clinic here at the health department. Spectrum, Mercy, Metro Health also have vaccination sites through their health system facilities. But the joint collaborative that we have there with Mercy, Spectrum, and health department, it's really kind of unheard of. I don't think there's anything of that scale and magnitude across the country. Yes, people have things with vaccination clinics of large sizes, but you just really don't even hear, even in Michigan, where those different health systems coming together to leverage their vaccine that they have in their allocations to be able to stand that up. With community vaccination planning, our medical director, Dr. Nurali Bora, is leading that effort, and Brian Hartle. And that is the setting where we are working very hard to invite community leaders. The invitation should be going tomorrow to engage some of our racial ethnic population leaders into that planning, which will have different subgroups on location and communications, multiple subgroups there. However, we also have partnered with Spectrum Health to provide vaccine clinics at New Hope Baptist Church and at the Wyoming Senior Center, and that's been going over very well. In addition to that, the community vaccination planning, we're working on getting a site stood up in our South Clinic over in the Kentwood area. And with the community vaccination planning, again, this will be Mercy, Metro, Cherry Health, Spectrum Health, Health Department, community agencies, those community leaders we're going to invite to that space and really want to utilize data, social vulnerability index data, as well as community input to drive where we should have locations, because ultimately the goal is that we would have vaccination sites throughout Kent County, both in the urban areas, in different zip codes that have been hardest hit, in rural areas where there's access issues there as well. We just want to make sure that we're not duplicating, we're not kind of stepping on each other in the community with vaccination sites, so that joint community vaccination planning, we have that commitment from our health systems in Cherry Health to kind of come together and see how we can plan, but we want to plan that with community, not for community. Yeah. So that is very important to us. So when I send the invite out, I'm sending the invite out to many of the organizations we've been connected with throughout, and to have at least a representative and an alternate join us for that. I'm also extending that same invite for those community leaders to join us for our race equity and inclusion team, so that people can receive not just updates on the vaccine, but kind of what we're doing overall with this COVID response. So again, it's very important to us.
Yeah, Teresa, you had mentioned the vaccination clinic, and I know because there were a number of people who had reached out to the NAACP about the recent vaccination clinic. I believe that was this week on Monday, right?
Yep.
And we shared that information through our communication platform, and received many calls from people who were thankful for sharing the information. And that's what we do. We want to share information and people can make an informed choice. But how many people were vaccinated at this last clinic at New Hope?
Yeah, I don't have the data on that right now, but I can say like when the first site was held at New Hope, I think there was between New Hope and the Wyoming Senior Center, there were 500 doses that were set aside. So 250 for one, 250 for the other. We had such a large waiting list that the Spectrum Health gave additional allocation for that location, and I think it was 400, and those were used. And then there was a clinic that was supposed to be Friday. I think Friday there were 800, 600 or 800 slots, and I think Friday, if that was the day of the snowstorm, I think that was canceled, and that might have been the one for Monday. So if we had 600 to 800 slots to fill, I have every reason to believe that those were filled. I'm just still getting more names, and as soon as I get them, I'm just passing them on. My understanding is as long as those sites are successful meaning if we have 800, we don't want vaccine to go to waste. We want to get vaccine in arms of people who want to get the vaccine.
Mm-hmm.
But it's my understanding that from the leaders at Spectrum Health for those sites, Stosh and Melissa Armstead have shared, like, as long as we can make sure those slots are getting filled, I'm thinking that there's going to continue to be vaccine available out of some of the allocations for that location.
Okay. Well, at some point, will you verify that number? I'm just interested in knowing what that number is. And we are past time, and I want all of you good folks to be able to enjoy the rest of your evening. I know we all are having very late nights, and so that would be great if you could just confirm that number again. What I will say is I encourage community to check out these live streams that are on our Facebook page. They're on our YouTube page, and they will be there. I think from the very beginning there were just a wealth of information from very knowledgeable experts, not only here, but from across the country. We will continue to do these as long as we feel we need to. And so I want to encourage everybody to visit the NAACP Facebook page. It's NAACPGR on Facebook. And then the same with our YouTube channel as well. And if you have questions, we have actually put up early on in the pandemic, a resource guide on our website. Is www.naacpgr.com. We're also working with Blue Cross Blue Shield of Michigan, and hopefully within the next week, we will Blue Cross will be publishing a vaccine resource guide, and then we will be distributing that through our communities across the state of Michigan. And so stay tuned for that as well. And I'm sure we'll probably end up putting a link to that guide on the NAACPGR's Facebook page. If any of you that are listening that's on the live stream tonight, if you have any additional questions, any follow-up questions, feel free to send those questions to info@naacpgr.com, or you may contact our office at 616-719-3478 with the understanding that we are actually off-site, but we are, as best as we can and as quickly as we can, responding to emails and phone calls that we receive. We look forward as well to everybody tuning in next week. We'll have some phenomenal guests on next Thursday on our COVID Uncovered series from starting at 6 p.m. I'll say. And so these live streams will happen every Thursday at 6 p.m. unless we have another immediate need that we have to attend to, like we did last week, and so we couldn't jump on. But again, I want to thank Teresa. I want to thank Mike, and I want to thank Dr. Unzinger for joining us this evening and taking time out of your schedule tonight to address these questions and actually provide what I consider a wealth of information that's been shared tonight. And so we really, really, really appreciate that. And Teresa, continue to do the great work that you're doing over there at the Kent County Health Department, and making sure that you guys are being intentional in connecting, not only connecting, but in terms of the work that you do in communities of color.
Right.
So
Got it.
thank you. And you guys enjoy the evening, and we'll see you next week.
Thank you.
Thank you.
Clay.
Thank you.
Bye.